everyone. Welcome to today's Pet Podcast. I'm your host, Dr. Roberta Westbrook, and you're here with us at the Campus for All Animals, the Houston SPCA. We're so happy that you joined us today. And today we are going to talk about another infectious disease. If you were with us 2 weeks ago, then you might remember that we spoke about parvovirus in cats, and we called that disease feline panleukopenia, but that was caused by a parvovirus in cats. Well, today we are going to talk about parvovirus in dogs and everything that you might need to know to keep your pups safe from parvovirus. Well, until we get on that topic, I do want to introduce you to our puppy of the week, and this is Snowflake. Is about a 10-week-old female spayed mixed breed dog. She's so adorable, and we can't wait for you guys to meet her and consider taking her into your family as a wonderful companion. And she's available with other puppies and cats and dogs that we have available. So please come on down to our adoption center. We're open 7 days a week, 11 a.m. to 6 p.m. There's no appointment necessary. We want to come help you find your next pet to join your family. So come on down and see us. Now, if you have any questions about parvovirus, please go ahead and put those in the chat. Many of you may have had puppies or dogs that have survived parvovirus, or maybe sometimes unfortunately did not survive. Wondering how to move forward, I can help you with those questions today. So let's get right into it. Let me know what questions you have.
So what is parvovirus and where does it come from? What causes it?
Right. So parvovirus is exactly as it sounds. It's a specific type of virus. The virus is one that affects the gastrointestinal tract, so the GI system in dogs. It can also occur in cats. We call it a different disease. We call it panleukopenia in cats, but you guys are probably most familiar with the parvovirus in dogs by calling it parvo and getting your dog's parvo vaccine. So parvovirus is one that affects the gastrointestinal tract. What it does is the virus particles live in the intestines and they destroy the intestinal lining. So they weaken and kill the cells of the intestines. When that happens, the intestinal cells begin to shed or begin to leave the body. What we typically see when a dog has parvovirus is results of that lining of the intestine being affected, dying, and then shedding. And so we see a lot of diarrhea, and oftentimes that diarrhea has blood in it. And oftentimes the blood can be in significant amounts. As a result, puppies are painful, their stomach hurts, they are lethargic, they oftentimes don't want to eat, and they may have vomiting associated with it because this virus is affecting the intestinal tract pretty severely. Parvovirus lives in the environment. So if you're wondering where your puppy got parvovirus, they got it from the environment. It lives in the soil, it can live in the grass. And so when your puppies are running and playing in the grass, if they are not vaccinated, which we'll talk about, if they are not vaccinated, they may come into contact with this virus. And the way that they get it inside their body is usually by licking. So they may walk on the grass, those tiny little virus particles will get on their paws. And as you know, puppies, dogs, they lick their paws, they're always licking the grass. And so they may ingest these microscopic virus particles, and that's how the virus begins to replicate in the body. So in essence, that's parvovirus. Those are some of the clinical signs that we might see. And that's how you can prevent your pet from being exposed is one, making sure that they have their vaccinations.
And then how is it diagnosed? Like just from those symptoms, or what else do we look into to confirm it is parvovirus?
So typically what pet parents notice right away is that their puppy that used to be very active and alert is now feeling kind of dumpy and lethargic, having diarrhea, vomiting, not wanting to eat. Maybe there's blood in the diarrhea or blood in the vomit. Typically that triggers the pet parent to take their pet to the veterinary clinic, to the veterinary hospital. And we as veterinarians will take that history. We get lots of information from you about what's been going on with your pet, and our suspicion will lead us toward doing a test. That test means that we will take a sample of feces from your pet, and we will run a test that takes about 10 minutes to run. And usually that will give us an answer pretty quickly. But things that are important to us are, one, where did you get your pet from? Sometimes when you have adopted a puppy from places where there's lots of other puppies that we don't know their history from, the virus can spread very quickly. So we always like to know where you got your pet from, if your pet is vaccinated, because vaccination is very important and can actually prevent infection with parvovirus. So we'd like to know where your pet was vaccinated. And then we ask you questions about the clinical signs when you notice them. All of those things give us a hint that this could be parvovirus, and we can run a very quick 10-minute test.
And is it similar to canine distemper? I know we talked about that, but I know they have similar, I guess it's shown similarly, like with the lethargic or.
Oh, question, yeah. The question about is it similar to distemper in dogs? Well, the two viruses are completely different. So there is a canine distemper virus that can cause some gastrointestinal signs, but canine distemper virus is actually predominantly a neurologic disorder, and distemper virus can affect the nervous system, the gastrointestinal system, the skin, but it's very different. Something that could be confusing is in cats that have feline panleukopenia, which is caused by a parvovirus, sometimes that disease is called feline distemper. And so there's a lot of terms that are shared between the species, but when you break them down are actually different. So feline panleukopenia is also sometimes called feline distemper, but the cause of that disease is a parvovirus. So a little bit confusing there. And on the dog side, parvovirus in dogs is caused by a parvovirus, but it's very different than canine distemper. It's a totally different virus, totally different disease. So, but it's a great question because both viruses can affect the gastrointestinal tract, and so maybe in the early phases, you could be concerned about both of those.
And so, if a puppy is diagnosed with parvo, what are the options? What do we do for them?
You know, viruses are sometimes very tricky to treat because oftentimes there's not a specific treatment against one virus. So a lot of what we treat the disease with is with supportive care. So because the dog has diarrhea, we may give drugs to help slow that down, to help decrease the diarrhea, and to prevent bacterial infections that are secondary to the diarrhea. We usually give medications to stop the vomiting. And because the puppies are vomiting and having diarrhea, they usually get dehydrated. So we give fluids to help with the dehydration, and we give antibiotics for secondary infections. Now, I do want to mention something that's very exciting in the veterinary world that is assisting us with the treatment of parvovirus. So one of the things that we like to do when a dog has parvovirus is if we could give them all of the antibodies that we need to fight the virus, that would be a great thing, right? Antibodies are little microscopic molecules that fight disease. Antibodies are good. We want antibodies against disease. So there is a new product on the market that we are able to use now that helps us to fight parvovirus. And what it is it's an injection of antibodies that are specific to fighting parvovirus. And what it does is it allows those antibodies to get into the puppy's body to neutralize the parvovirus. They're basically little soldiers that we're injecting, and these soldiers fight off the parvovirus and prevent them from getting into the intestinal lining. And it helps the dogs that have parvovirus to recover faster and prevent even the worst case scenario, which is death. And so we've had great success with it. We've been able to treat several puppies here that have come to us with parvovirus with this new treatment. So if you think that your pet has parvovirus or you're concerned about it, please talk to your family veterinarian about this new treatment called the parvoviral monoclonal antibody injection. The parvoviral monoclonal antibody injection. It's made by a company called Elanco, and so it's something that you can certainly talk to your family veterinarian about if your pet comes down with parvovirus. It's a wonderful way that we can help to save lives.
And obviously, cost might be, a factor in determining what type of treatment, options. What is the typical cost for even the supportive type of treatment?
Yes, parvovirus can be expensive because typically it requires hospitalization, and sometimes that hospitalization can be for up to a week, sometimes several days, sometimes a week or longer, depending on how severe the symptoms are. And so you can easily be looking at $800 to $1,000 or more to treat your puppy for parvovirus. So it can be an expensive treatment just because it requires such intense therapy. In some cases, without this intensive therapy, death is a possibility. We want to be able to prevent that. So it can be expensive treatment. The way that we can avoid this is making sure that your puppies are vaccinated. That's the best way to make sure they're vaccinated, that they have all of their sets of vaccines, which is usually 3 to 4 sets of vaccines. And then also making sure that they don't come into contact with other dogs or puppies whose vaccination history is unknown. Strays, or going to dog parks when your puppy is really young. Those things can actually put your puppy in a situation where there could be parvovirus around, and we don't know the vaccination history of all of the dogs that could have been there.
So for safety wise, when is it safe for the puppy to be introduced for the puppy park? You said whenever they've had all those 3 rounds of vaccinations?
Absolutely. Typically, it's after, depending on the age, the 3rd or 4th set of vaccines. And another way that you can gauge that is not only the number of sets of vaccines, 3 or 4, but also the age. So right around 17 to 20 weeks. So 17 to 20 weeks old, most dogs are what we call immunocompetent. They've either gotten the vaccines that they need, or their immune systems are strong enough that when they encounter disease, that they're able to fight it off. But vaccination is most important. And then age 17 to 20 weeks is a good period of time to wait before your puppy is introduced to other dogs.
Which is kind of my next question. So if they do have the vaccinations, can they still contract it, or not as strong? Or obviously, do we need to redo the vaccinations every year? How does that work with protection?
Right. So once your puppy is fully vaccinated with their early sets of shots that are that usually begin around 6 to 8 weeks old and go all the way up to about 16, 17 weeks of age. Once they've had those initial shots, then we give those vaccine boosters every year. And so as long as they're getting these vaccines every year, you can also talk to your veterinarian about an every 3-year vaccine. But as long as they're staying on schedule according to your veterinarian's vaccine protocol, they should be healthy and able to go to dog parks and interact with other dogs. I do want to mention, though, that vaccines are not 100%. So there's no vaccine that we can 100% guarantee that if your pet is vaccinated, that they're not going to get parvovirus or any other disease. The reason for that is it depends on the health of the individual's immune system. It also depends on the load of virus or bacteria that they're coming into contact with. So sometimes the load, the amount of virus that they're exposed to is more than the pet's immune system can fight off. And so in most cases, vaccines are preventative, but there are a few cases where sometimes the amount of virus and bacteria that your pet is coming into contact with is more than their immune system is able to fight off. So it's just something to note that they're not 100% effective all the time.
And I guess that goes with there's a myth that parvovirus only affects young puppies, but obviously if it's an adult dog or has a lower immune system or has never been vaccinated, we can see it. It's sure rare, but we can see it with them.
Yes, it certainly is less common for adult dogs to get parvovirus, but we see it occasionally where we may see a dog that's 1 or 2 years old that actually has the symptoms and tests positive for parvovirus, and that's because it has to do a lot with their immune system. So if they don't have a competent immune system, one that is, that has antibodies against this virus, and if their immune system is not strong because maybe they've got other diseases or other illnesses, they still can succumb to parvovirus.
And if a puppy recovers, are there any effects that we can see long term?
Yes, great question. So what effects do we see long term from puppies that have recovered from parvovirus? The good news is that generally there are not any long term effects, and they can go on to live long, happy lives, and you may never know that they were affected with parvovirus as a young puppy. And that's the good news. There are some other viruses that affect puppies that have ongoing issues, but parvovirus, if they recover, the good news is they are expected to live a long, happy, normal life.
And if I foster puppies with parvovirus, can I keep fostering puppies, or is it safe not to because we don't know how long the virus lives?
Right. What if you've had parvovirus in your home and you want to get another puppy or another dog? What are some precautions that you should take? Number one, thoroughly clean your home. Parvovirus can live in the fabrics, in your carpet, the fabrics of the bed, your clothing, the bottom of your shoes. It can live there, and it can live for a very long time. It can live weeks, months, and in some cases, like in your yard, it can live years. So you want to make sure that you are thoroughly cleaning and discarding anything that cannot be disinfected. So if you had a puppy with parvovirus, and there was a bed or blankets or towels or anything that you used with that puppy, I would discard those. Then any other objects in your home, toys that can be cleaned, the floor, the walls, the crate, those can be disinfected with chemicals that can kill parvovirus. For example, dilute bleach, 1 part bleach to 32 parts water is something that a lot of people have access to and can kill parvovirus. And so the problem is your yard. Parvovirus can live for a very long time in your yard, years, and it's going to be very difficult to disinfect your yard. And so I would recommend that before you get a new puppy, that you make sure that puppy has had at least 2 sets of vaccinations and is older than 17 weeks of age. We want an immunocompetent, strong immune system puppy that's going to be going into that environment because we want them to not contract that virus. So make sure you're getting an older vaccinated dog or older vaccinated puppy if you've had parvovirus in your home before.
And if you want to protect your puppies, where can we go to get these vaccinations?
Yes, we would love to help you protect your puppy from parvovirus. So please come on down to our pet wellness clinic. We are open from Thursday through Sunday from 10 a.m. to 5:30 p.m. So please come on down, speak with our veterinary services team and our veterinarians, and we are happy to help you find the right protection for your puppy. We want to be able to help you for the life of your puppy. So come on down and visit us. We'd love to have you. Well, thank you guys so much for joining us every week and taking the time to learn a little bit more about keeping your pets happy and healthy. We're here for you if you need any questions or you have anything that you'd like to bring to us. We hope that we can be helpful to you. So come on down to our adoption center every day, 11 a.m. to 6 p.m. If you're interested in being a part of our extended family, please go to HoustonSPCA.org and look at ways to give. We would love to have you as a volunteer or a foster parent and be a part of our mission here at the Houston SPCA. We thank you again and hope to see you next week on the Pet Podcast. Bye-bye.